Hi, I'm Dr. Rajani. Thanks for joining me today. The hip dip, the perfect buttock is in. People are trying to get it, whether you work out, whether you don't, whether you have cellulite. This is going to be good for cellulite as well. I'm going to show you the treatments today, and I'm going to throw in at the end a bonus little bit of footage on a PDO thread, a barbed thread being put in the buttock area to get some lift and to work with the Sculptra that I'm going to use to treat the hip dip. Now, aesthetic procedures are optional, and I can already hear people are going to say, she didn't need it done, and people want the perfect bodies. And yes, people are on TikTok and they're on Instagram, and exercise is one of the most important things that make people look great. And when we can facilitate someone getting that perfect look, because a lot of times those with hip dip are your workout people, particularly females coming in that work out a lot, that get that dip because they don't carry a lot of weight. But of course, all comers have it. Some people that carry extra weight do have it, and they need a little help to round it out. So whatever category you fall in, Sculptra can work well if you don't want to have fat transfer. And of course, the Kardashians and all of the TikTokers and Instagram have made that perfect buttock popular. So it's a major driver to practices. But I get where some people don't believe these aesthetic procedures should even be done. One thing's for certain, don't put cement or Fix-A-Flat or fake products. I don't even like PMMA or polymethyl methacrylic acid placed in there, although in some countries that and bioalchemid can be used. Let's watch the videos now. Certainly like these videos. If you want more of these and you smash that like button, I'll put more of these up. These are videos where I'm showing the procedures being done. So some people like them and some don't. But if you're a practitioner and you want to learn more, go to aesthetictrainingcenter.com. We have virtual courses now where I send a monthly membership video to people, the AMIT. Let's watch the procedure now. So cleansing, obviously one of the most important things we do. We want the product to be sterile and clean, and of course the area. So here I'm using a 18 gauge needle to place an opening because I'm going to use a micro cannula. The micro cannulas have really revolutionized what we do. To do a buttock, you need a large cannula. Obviously not as large as if you're using fat. This is Sculptra, so this is best for people that don't have a lot of fat to move around, so they're in shape. It's not the least expensive procedure out there because of it. If it's just for the hip dip, it's not too bad. But if you're doing a full buttock rejuvenation, it can get pricey. A lot of times people's fat is a lot more cost effective. And here, Sculptra is a liquid, so there's PLLA, poly-L-lactic acid. And it's a specific concentration. There's very many things to be considered in this. One is, and I've seen it happen, lidocaine, for instance, we put numbing in there and it can create toxicity. So you have to be very careful. Even the diluent used can create alcohol toxicity. Now here I'm using a thread. A lot of people love threads. This is a large gauge thread. Now we even use larger ones. But you get the idea. We're putting the thread in through the opening. And you can see the thread. It's not that deep. If you go deep, you're not going to get lift. But cellulite will be helped by the thread, by the Sculptra, and even putting the needle and cannula through can break down adhesions. At the same time, you stimulate collagen, and it's probably the most effective product, meaning Sculptra plus or minus threads, but you need that PLLA for cellulite. Even the new products on the market have minimal effect, even the collagenases. So here I'm putting the thread in, basically setting it. And what that means is you're setting those barbs. Again, and I would use 3 to 6 per buttock. You can certainly go to styleaesthetics.com if you like before and afters. We have many before and afters of these threads, Sculptra, all kinds of different combinations. And you see here, again, you can see where that cannula goes through the skin. You have to set it because I'm looking for lift. And you'll see the thread here at the end. You see the thread come out. And the earliest threads we had, a lot of times there wasn't enough thread for buttocks, but now we have special threads that are longer, bigger, and they're molded. So barbed threads are good, but the moldeds give much more lift. You can see the thread coming up here. I'm grabbing the thread on the top of the screen and we're just massaging it up. and setting it. And then I'll cut the thread and burying the thread. I have a whole video on the importance of burying the thread. And then I made another opening over here. We're going to now use Sculptra in the superior aspect, and what I'm doing is just creating that perfect mold, that perfect projection that people want at the top of the buttock area. It also does create lift because you're creating volume here. Notice I'm using a very large 50cc syringe, so you put a lot of volume in at the correct dilution, okay? The dilution, how you mix it, and of course lidocaine toxicity is a big problem and it's not good, and it can create death. So even if you have the right product, the volumes and how it's used is important. So see somebody trained, whatever you're doing, and real product. One of the biggest things people try and cut corners, this does cost money. If you find it unusually inexpensive, be careful. Watch my video on cement in the buttock. Does not look good. There's some botched episodes you can watch on that. It's a disaster and it's actually very sad. So the collagen, what this will do is build collagen, it breaks up the bands, and results occur over months. It's often why people like those results because they're nice and gradual, although you get the immediate effect for a week or so, but the results will last. A lot of times those results at 5 to 7 years, I'm just topping patients up a little bit after that, and then the idea is to get the hip dip improved. Here you can see a before and after where we've created a better projection. You just have more of that shelf at the top and a nice projection of the buttock, and that lifting lower can reduce cellulite and give a nicer look for a smooth buttock that everyone's looking for. Not everyone's a candidate. So with all these procedures, understand I'm picking the people that are going to get results. If you take someone with too high of a BMI or body mass index, they're best served with fat transfer. And yes, the death rate is 1 in 1,300 or so. It's one of the most dangerous procedures that's done, but it is popularized by the stars of the world. So understand the drive for wider hips, larger shaped buttocks. Talk to social media about it. People come in the door in droves for that look. But understand if you're the right candidate, yes, it's reasonable, it's cost effective, it's long lasting. I put a playlist up here where you can watch all kinds of procedures involving Sculptra. What do you think? Have you had it done? Do you like it? Do you dislike all of this? Let us know in the comment section. Stay tuned here. Keep your skin and body beautiful, healthy, and vibrant.